It's always obviously very devastating and challenging to hear the words, "you have cancer." And I think the important immediate thing that a physician and the medical team needs to do is to really develop that plan of action. I think the waiting and not knowing what the treatment options are going to be is a very difficult time and a source of a lot of anxiety. Once we are able to explain what the treatment options are and explain the availability of these new approaches, it certainly helps a lot. But there is so much range, and the range in how much a patient and a family member or friend wants to hear about the diagnosis or wants to investigate these new treatments. So sometimes patients say, "Whatever you say, doc, I'm in your hands, do it." More and more, which I think is great, patients come in armed with lots of information, and I think programs like this are essential. We want our patients to be informed. We want them to understand the risks and benefits of each of these approaches. And, there's not always one right answer, and to explore with a patient what are the most important things to them right now. Sometimes the concern about side effects or logistics of a particular treatment are important to factor in. So I think it's critical to find a medical team that is responsive to a patient's needs, that they feel comfortable being able to ask questions and provide the necessary information. Having the education, the knowledge, and a plan, I think is a very effective. It helps a lot in reducing the anxiety associated with a cancer diagnosis. I think importantly, one also has to develop that communication plan. When somebody starts a treatment or is having a new symptom or new problem, that they know how to contact their team. They know who the administrative assistant, who's that nurse is, who's that nurse practitioner, who the physician is. It really is a team approach, and having that open communication and how to best communicate it, I think, is also an essential part of the medical experience of handling cancer.